Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program.
Today, noted periodontist Dr. Lee Sheldon answers the question, are too many teeth being extracted? You may be surprised to learn the answer, as well as other ways to address the challenges that may be going on with your teeth and mouth care. Dr. Sheldon visits with program host Kerry Fink on this edition of Helping Seniors TV.
I'm Kerry Fink with Helping Seniors TV. It's my pleasure to be here on behalf of Joe Steckler and the entire Helping Seniors of Brevard team. And really excited to have in the studio today our guest, Dr. Lee Sheldon, who's a noted periodontist. Welcome.
Thank you, Kerry. It's good to be here.
Good to have you on the show. And we have a very provocative title for today's show that Joe wrote down here. Are too many teeth being extracted?
Wow, I wonder where that title came from. I wonder who wrote that title.
That's a good question. Well, and you're the right one to answer the question. So, as Joe wrote this note, he says, you say there are too many teeth being extracted. Why is that?
Oh, shucks. Why would I say that? Because I do so many dental implants, and so I am sucking teeth, or at least my office is. Are too many teeth being extracted? The answer is absolutely yes.
Wow.
You know, I'm a periodontist. And a periodontist is there to diagnose, treatment plan, and determine what teeth can be saved and what teeth can't. There are so many people who are going through periodontal disease and have some kind of a feeling that periodontal disease can't be treated, that they say, all right, I'm going to go and get my teeth out and put implants in, and that'll be the end of it. You know what? It's not. One of the problems we have here, and it isn't just here in Brevard County, it is all over, is that there are assumptions made that periodontal disease can't be treated. There are assumptions made that if you have periodontal disease, you're eventually going to lose your teeth anyway, and therefore, why bother? Or keep the teeth, but then when they start to have a little bit of a disease, fine, take care of the disease before you lose too much bone support, and that way you won't be able to have dentures or dental implants. Unfortunately, nothing's further from the truth. And the problem that we have is that people are not being diagnosed, are not being seen by a periodontist when they have periodontal disease, because periodontists are capable of saving teeth, a lot of teeth.
Wow. Yeah.
And therefore, while I do dental implants, and probably do more dental implants than anybody in the county, at the same time, I want to make sure that we've looked at both options, and that in fact that we can see that in fact, if a tooth can be saved, and not just be saved as a loose tooth. I mean, being saved in function, in health, and looks good, that at least we explore that option as much as we'll approach the dental implant option. So the answer is yes, too many teeth are being extracted because of false assumptions that diseases can't be treated.
Well, and isn't there, because I know in our own family, my wife had gone through a lot of mouth pain for a period of time where she was at the point of just yank them out. It hurts so much. And it would probably have been helpful at that point if she had run into you to be able to have the benefit of having somebody really look at it from a whole mouth perspective.
Yeah, I think so. I think that there are some assumptions there that periodontal disease can be treated in the general dentist's office, and it can. But if the assumption is that the periodontal disease is only treated in the general dentist's office, and that appropriate referral isn't made when things get out of control, example, there is dental hygienists are trained for 2 years in a dental hygiene school, and they're given the skills on doing root planing. Okay, that means deep scaling means you've got bacteria below the gum line, you reach below the gum line, and you clean the bacteria out. And that's fine. What people don't know is that they can only clean out below the gum line to a depth of 4 millimeters.
Okay.
Okay, so let's assume you have your periodontal examination, where you do the probing and the dentist is shouting out numbers, okay? 5, 7, 9, 3, okay? If the assumption is that a patient has a 9 and therefore it can't be treated because the hygienist wasn't successful in treating it, what does that mean? It only means that the hygienist doesn't have the tools to be successful in treating it. So what can you do? Well, there are laser therapies you can do. There are surgical therapies you can do. What I love, as you know, is the endoscope. Same type of endoscope you use for your knee or for your belly button, for any kind of surgery that you would use.
Right.
There's this tiny endoscope that goes down below the gum line.
Yes.
So now we can get down 9 millimeters, see down 9 millimeters, and clean 9 millimeters, where because we're seeing what's there. Where hygienist only goes by feel, and we know that by feel they're only good. They can only clean down 4 millimeters. How do we know that? Yeah. They gave the hygienist as much time as she wanted to clean each individual tooth in the mouth. And they've done this several times. And these were teeth that are going to be extracted. So they say, hygienists, take as much time as you want. One famous study, the hygienist spent 45 minutes on each tooth on the lower arch and 35 minutes on each tooth on the upper arch, or vice versa. Then they extracted the teeth and they saw how well the hygienist did.
Wow.
4 millimeters.
Wow.
5 millimeters, some beyond 5 millimeters is total crapshoot.
Wow.
And so again, if we go with assumptions that only that the hygienist couldn't get it under control and there's nothing else that can be done, there's a lot that can be done.
Yeah, and you have a lot of technology in your office. Like you said, you have that perioscope or whatever the tool is called, where you can actually go down and look with a TV camera kind of device and see what's going on. You have like a CT machine that you're able to get like all sorts of dimensions and things.
CT machine is great. It's great for determining bone levels. It's great for determining dental implant or the availability of bone for dental implants. So all of that is there. But you're right, the diagnostic instrument that we use is the perioscope, is the dental endoscope to get down below the gum line on a patient who has periodontal disease. It's the primary diagnostic method. What other diagnostic methods do we have? Let's assume that you had a constant sore throat. And you kept on seeing the doctor and they tried different things and nothing happened. What would the doctor then do? Doctor would take a swab and do a throat culture to find out what bacteria is growing there. Well, what should we be doing in periodontal disease? Just probing? No. You spit in a cup, you send the saliva sample out to a lab, and you find out what bacteria is growing. Maybe there's an antibiotic that can help with the bacteria. And we know that the bacteria in the mouth also goes to the bloodstream and now has been implicated in heart disease, diabetes, and Alzheimer's disease, and you name the diseases that look at periodontal disease, they're finding associations. If we find that association, maybe it isn't just the deep cleaning, maybe an antibiotic is going to help. So there are a lot of things that we can do before we have to say, all right, we extract teeth and we replace with dental implants.
You know, that's a real, you actually answered the second question, I think, already. No, it's okay. It says, why save a tooth that has periodontal disease? And I think one of the things, at least as a layperson, that I picked up is that there's reasons to treat your mouth in that way because it could have actually potential health benefits or prevent worse health situations.
It's true. It's true. I just had a patient just before coming over to the studio today, a patient who we had seen. And seen for periodontal treatment 5 years ago. And the periodontal treatment was very successful. He continued to smoke up until last year. And smoking is one of those things that causes tooth loss or causes periodontal disease. By the way, smoking also causes a disease that nobody's heard of. You don't see them on the TV commercials. Periimplantitis. Oh. Periodontal disease is loss of bone around the tooth. Periimplantitis, what do you think that is? Loss of bone around the dental implant.
Oh, wow.
So the same things can occur to dental implants that that occur with natural teeth. Sure. Anyway, we saw this guy. Sure enough, he had a loose tooth. He'd had a periodontal reinfection. Thank God he stopped smoking last year.
Good.
And so now we're going through the diagnostic stages again, and we'll treat the reinfection. And I guarantee you, that tooth will tighten up. We'll get back what we've lost simply by going back to basics,
Right.
diagnosing, finding out what's really causing the problem, doing the things that we need to do to clean things up, whether it's antibiotics, whether it's perioscopy with deep scaling, whatever it is, we'll take care of that, and then the patient's disease will go away. And if it doesn't go away in that one tooth, fine. At that point, we'll extract the tooth and put it in the dental implant.
So I was going to say that would probably lead to the next question is, when is it time to extract a tooth? How do you get to that? Obviously, there's a million factors, but how do you generally arrive on, like, okay, this one should go?
I think there are a couple things. Number one, we're much better at controlling periodontal disease than we are controlling rampant tooth decay. So if a patient has rotten teeth, yes, we can do root canals, and again, if you have root canal done, just like I'm saying, if you have periodontal disease, go see a periodontist. If you need a root canal, go see an endodontist. That's what they do for a living, and they can do it real well. The predictability is there. But if the tooth continues to rot, either due to a lot of bacteria in the mouth, we can't reverse that with all of the different things that we've got, fluorides and taking care of acids and all sorts of things, then at that point it's probably time to extract the teeth. When it comes to periodontal disease, if you've kept the teeth for as long a period of time and you're very long in the tooth and you can't hide that smile, well, sometimes cosmetically as well as functionally, we can do a better job with dental implants and the prosthesis that is put on the dental implants, the teeth, than we can in trying to preserve something you might not like the appearance of anymore.
Right.
So some people say if a person would eventually lose the tooth that has periodontal disease anyway, why would you attempt to save it?
Well, I think the first thing is, would you lose the tooth? And the answer is, until you've seen a periodontist, you don't know.
Okay.
So if you see a periodontist, and the periodontist is good, I'm not just saying me. I mean, this is not to ballyhoo me at all. It's see a periodontist, take a look at the periodontist, make sure the periodontist is doing the diagnosis and treatment plan. You may find the teeth that otherwise would have been condemned can be saved. But then the question is, with regard to extracting the tooth in order to be able to save the bone, there are some isolated cases where that will occur. But for, I'll say, the majority of cases, extracting the tooth early doesn't do anything else to preserve the bone so you can have a dental.
Well, that's funny. That was actually going to be the next question.
I must have written the question.
Well, you did good, because others say that if you have a troubled tooth, maybe you need to go ahead and take it out so that you're going to preserve the bone in there. But what I hear you saying is that it may not necessarily be true.
It may not necessarily be true. There are some cases, Kerry, where it is true, and it is a judgment call. For the most part, though, no, it isn't true, and we can listen. We do a lot of dental implants, and I'm not saying dental implants are bad. I wouldn't be doing them if I didn't think they're good. It's let's make sure we're using them appropriately.
Well,
and let me just follow that up a little bit. You're seeing TV commercials all over the place.
Sure.
TV commercials. Oh, I had this horrible periodontal disease. I couldn't get it under control. I went to blah 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 place. They took out teeth. They put in the implants, and they put in the teeth all in the same day.
Right.
And I do that too.
Right.
Okay, we do that. I think the difference is if you go to those places, that's the only thing they do. They extract the teeth, they put implants, and that's all they do. That's nothing else. That's it. Or if you go to a diagnostician, the diagnostician is going to give you a choice of one versus the other if in fact that choice exists.
Well, it was interesting because I was thinking, even this morning I was talking with a lady that was saying that she'd just been to a dentist and she now was thinking that the referral was that she needed to have an implant. And I was explaining to her that in your office, you're sort of equipped on a lot of different levels because you're able to handle general dentistry, but you also have Dr. Furtado, who's also a periodontist. You have this ability to look at really complex cases. How does that benefit a patient to be able to look at it from an overall perspective?
Well, if we're talking about, listen, I was fortunate. I had a very successful referral practice for most of my career. And then my son decides he wants to be a general dentist and he wants to practice with Dad. Okay. that usually isn't done. That might happen in bigger cities, but practicing with that. But I mean, having a general dentist and a periodontist under the same roof, it kind of kills your referral practice. So the question is, all right, what are the advantages? Well, the advantages that we have is, number one, I get to oversee everything.
Sure.
But so having everything under one roof is great. It's great for the patient, because the patient is seeing one set of doctors, one set of staff. Dr. Matt Sheldon, Dr. Michelle Furtado, and I meet every Thursday morning at 7 o'clock. You want to know where we are Thursday morning at 7 a.m.? We're at our office discussing cases together.
Wow.
So I love it. I mean, obviously I'm at the tail end of my career, but to be able to have the advantage of being able to work with the doctors I work with every day, that's great. But that doesn't mean that we still are a referral practice. Right. It doesn't mean that you can't have the same advantage in a referral relationship as well. With the x-rays and the opportunity for online meetings because of the digital technology.
Sure.
If you're with a good general dentist and a good periodontist and a good group of people, you can get it done in the referral model as well.
Yeah. So, and I was going to say, speaking of your expertise, you also head up a whole national organization where you're actually talking with other practices around the country about how you can best serve patients and things like that. How does that fit into all of this, too?
Yeah, that's my second love. It is. It came about simply because Matthew was working in the office. Periodontists are not getting, and most specialists are not getting, the numbers of referrals they were getting before. That's my pet peeve. It's being kept in the general dentist's office and often too long.
Right.
And so I'm teaching specialists how to go directly to the patient in order to let the patient choose them first.
Right.
Yeah. And so that's my national organization. It's the Institute for Dental Specialists. And we have a small dedicated group that thinks I know what I'm talking about. We have webinars twice a month, and it's fun.
Oh, it's good. Well, so kind of back to the actual treatment question. What do you do about people, and I don't know how this is all interrelated because I guess I'm like the typical person who doesn't understand enough about this, but what do you do about people who continually get tooth decay? How does that fit into this whole equation?
Well, there are a lot of things that we're looking at now. The people who continually get tooth decay, one of the questions is why, okay? So the number one answer is sugar. But as we get older, we get dry. Our skin gets dry, our mouth gets dry. And when you have a dry mouth, then that mouth is acidic. So in other words, your teeth are being bathed in acid. You no longer have saliva to act as a buffer against that acid. And particularly if we're taking medications, there are over 500 medications that cause dry mouth.
Wow.
And if you have dry mouth, it means low pH means acid. And so, simple thing, baking soda rinses. It can reduce the acid. You can buy paper, like litmus paper. Remember litmus paper in high school?
Sure.
You can get graduated litmus paper, which will show you the pH of your mouth. You can go to the drugstore. You can go on Amazon. You can buy pH paper. Wow. You buy pH paper, and then you can check your own pH. If you're at 7 or above, you're good. If you're below 7, you're acidic.
Wow.
And so then you can determine how often you do baking soda rinses in order to be able to keep your pH up. There's also probiotics. There are probiotics that dissolve in the mouth. So let's assume that you have a bacteria, the type of bacteria that causes tooth decay. It may be that by using these probiotics 2 or 3 times a day, that you'll reverse the bacterial flora and maybe have a healthier flora and therefore prevent tooth decay. And then there's fluorides and things like that.
So much of this really comes back to the fact that when you don't know, you just don't know. And so if you were talking to viewers of the program today, how would they, if they were fascinated by maybe some of these options and wanting to get a real story, maybe somebody said, no, these teeth have to come out, or all these things, or I saw this commercial on TV, but I don't know. What step would you encourage them to do? Would they call the office and say, let me come in and have a look, or what would you advise?
Particularly when there's a drastic step or a severe step or life-changing step that's going to be made, get a second opinion with a specialist. Get it, and we can talk about me or coming into my office, or there are other qualified specialists all over the county. you can go to and let that specialist do an evaluation and find out whether in fact that's true or whether there are alternatives.
So I remember, I don't know if it's still valid. Do you have a sort of a new patient? I think there was something that actually benefits a charity, or is a program like that?
Yeah, in our office we have a charitable giving campaign. It's usually for referrals, but for viewers of this program, they get the same thing. So yes, we have a charitable giving campaign. There are 8 charities in our charitable giving campaign, including helping seniors in Brevard County,
Which we highly recommend.
That's right. So if you write a check, come in the office, bring a check in, write a check to Helping Seniors of Brevard County. For $50 or more, you'll get X-rays, CT scan, full evaluation. You'll be in our office 2 hours. You will have a thorough evaluation and know exactly what's going on.
So, and that wouldn't that be a wise first step when you're sort of floating in a sea of misinformation or not sure if you're getting the right information? Wouldn't that be a valid step to do that?
I'd like to think so. And also give us more to do on Thursday morning at 7 a.m. as we discuss your case.
How do people get in touch with the office? Is there a phone number? What's the best way to get connected?
Give us a call, 321-259-8000, 259-8000.
So, and I know this is a tougher thing because all, we get calls, as you know, Helping Seniors of Brevard is this organization where we have a senior info helpline, and we get, I was saying earlier, we've helped over 2,200 families in Brevard County free of charge, absolutely free. This is really what Joe's legacy and testament has been, is making sure, because when he came out of this environment of having started the Alzheimer's Foundation, I remember when he started this, he was telling us, he said, Kerry, people have memory issues sometimes as they get older, but there's a whole plethora of issues that goes well beyond all of that. And so his charge for Helping Seniors has always been to try to be a resource and help people. We get calls a lot of times from people who are really in drastic circumstances. Their finances are just that they're choosing with $700 a month whether they're going to eat, whether they're going to have a prescription that they need, and it's really some very tough choices. What advice do you have for people if they're like in an emergency with mouth pain or things like that? Is there any place that you go? I know Joe had written down people can go to the hospital in an emergency, at least to maybe try to get out of pain. But do you have any thoughts or directions to help people like that?
In the hospital, you'll get antibiotics and pain medication. There are emergency dental clinics, and I was going to say look in the phone book, but who does that anymore? Right. But look online, you'll be able to find an emergency dental clinic. There is one in Rockledge, and I believe there's one down in South Melbourne as well. And we refer patients there as well. If we're looking at multiple teeth that need to be extracted, listen, dentures were around. They were around in George Washington's time. They're still around, and there are discount denture clinics that can provide patients with at least the ability to smile and somewhat of an ability to chew. It's not the same as dental implants, obviously, but at least it'll take you out of pain. And frankly, the most important part of this, Kerry, is to get that infection gone.
Right.
And sometimes extraction is the way you have to do it. And so there are places where you can do that at a reduced fee.
But at the same time, is if, like you said, through the charitable giving program.
Brevard Health Alliance also has a dental clinic. That's right. Okay. Yeah.
Well, what I was going to say is, but if it's really as simple as getting involved in the charitable giving campaign, maybe as a place to start, wouldn't it make sense for somebody to invest that charitable donation, come to your office, get kind of a full understanding of where they sit? Wouldn't that be a right place for somebody to?
I would think so. I mean, understand that if you're going to have that kind of care that we deliver, there's a certain financial resources that you need to have. But yes, if there are doubts, if there are questions, if you don't like the way things are going, I think a second opinion with a specialist, whether it's with us or somebody else, yeah. I mean, and for us, yeah. Give $50 to one of the 8 charities in the campaign, and you will get definitely the once over, twice over, 3 times over. Believe me, you'll leave here with a lot of information.
That really seems like a smart approach. So, because when we come back to the topic of the show, are too many teeth being extracted? I guess even just logically as a non-dental person, it would seem like, well, every case is going to be different, so it's hard for you to give a sweeping panorama without knowing the particulars of somebody's case.
It's true. I think the reason we established this topic to begin with is because, yes, too many teeth are being extracted, and it's based on a 30-second commercial. And listen, I market. You've received my magazine.
Sure.
We all market.
Sure.
Understand that marketing is marketing, but examination, diagnosis, and treatment planning is something else. We're marketing in order to be able to get people into my office. So are they. Mm-hmm. Don't look at that as being the panacea, and everything is going to be wonderful. Believe me, you've got to look at it from a lot of different perspectives, other than 30-second commercials saying everything is wonderful.
Well, and actually, I was going to say, isn't that sort of an important factor that you've been in practice in Brevard County for a very long time? So you've also built up quite a group of success stories of people who say, no, these are referrals, and these are people that I would say to ask them about the experience at your office.
That's true. I mean, that's this time in my life. You want to look back and say, hey, it was a good career.
Yeah.
I was able to help some people, and the fact that we're able to see people for 30 years and keep their teeth in their mouths, or extract teeth and put in dental implants. Right. I like doing that too. And they're smiling, they're chewing, and they have new relationships, and they have new jobs, and all of these kinds of things. Wow, just their teeth? That's pretty darn good.
And so really, I guess the takeaway from today is give your office a call. What's that number one more time?
598,000, 321-259-8000.
And designate Helping Seniors as your designated charity,
right.
And everybody wins.
That's
And you'll find out if too many teeth are being extracted would be the way. Thank you, Dr. Sheldon, for joining us today. It's always a pleasure to have you on the TV, on the radio, and all the things that you've done over the years for helping seniors.
Thanks,
really
Kerry.
appreciate it.
Great being with you today.
Thank you. And thank you, viewer, for joining us for Helping Seniors Television today.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniors.brevard.org. Thanks so much for your help. It does make a difference.